Is there anything worse than a painful hand injury when you're a pianist? Especially if you're a professional musician, making your living playing the piano. Hi, this is Alan Willett with another episode of the Tennis Elbow Classroom podcast. Yes, pianists can develop tennis and golfer's elbow too, along with a host of finger, thumb, and wrist-related injuries. Are you just beginning to experience pain in your fingers, wrists, or elbows from playing? Or do you already have an established injury or pain pattern? Either way, I wouldn't be surprised if you were agonizing over the question of whether you need to stop playing or not, and I may have some good news for you on that later. But even if playing the piano is more of a hobby to you and not your profession, and you're not totally freaking out about the pain, it can still suck a lot of joy out of playing, can it? So whether you're just starting to notice symptoms like stiffness, tension, and pain that still resolve with rest, or you already have a full-blown injury that doesn't seem to respond to anything, this episode is dedicated to helping you better understand these incredibly frustrating injuries and find the right treatment path. We're going to cover some things that you may not hear anywhere else, and which will likely contradict what you have heard. But if you keep listening, I'm confident you'll see why a lot of the common wisdom about these injuries is actually wrong, and how shifting your perspective may help you gain a better, faster, and lasting recovery. We're going to cover the truth about tendinitis and inflammation, the myth of total rest, the missing link in piano RSI treatment, and the standard treatment approach compared to what I believe is a much better strategy. But first, can you really get golfers or tennis elbow from playing the piano? Absolutely. Piano-related pain can appear in many different places, including your back and neck, shoulders, elbows, forearms, wrists, and fingers and thumbs, of course. And I should point out that if you spend a fair amount of time on your computer, you have another activity with very similar biomechanics that may also be contributing to your pattern of tension and pain. Sure, your elbows may seem like an odd place to hurt, but keep in mind that most of the muscles that act on your wrist and fingers have their origin tendons way up at your inner and outer elbows, which puts pianists and keyboard players at risk for both tennis and golfer's elbow. They're referred to by these terms regardless of how you get them, by the way. Pain at or just below that little bony knob at your inner elbow usually turns out to be golfer's elbow, technically called medial epicondylitis. And pain at or just below that little bony knob at your outer elbow usually turns out to be tennis elbow, technically called lateral epicondylitis. Although epicondylosis or epicondylopathy are terms you may run into that are often a better fit. And some injured pianists may have symptoms from their inner or outer elbows all the way through their forearms and into their wrists and fingers. These injuries, along with carpal tunnel syndrome and various wrist, finger, and thumb tendon problems, fall into the category of repetitive strain injuries, or RSIs. Not to dismiss rotator cuff and other shoulder injuries or back and neck pain, it's just that I usually focus on issues from the elbow to the hand. Unfortunately, these stubborn tendon problems can sometimes be more difficult to recover from than acute injuries like fractures or sprains. This has a lot to do with the nature of tendons and tendon injuries, including the simple, unfortunate fact that tendons are notorious for not healing easily or well. They often need a great deal of encouragement and can't just be left alone and expected to heal. Now, what about tendinitis? You hear that word a lot. Isn't that typically the issue? Well, there are a lot of myths and a great deal of misunderstanding about the true nature of many, if not most, chronic tendon conditions. In fact, they're not usually tendinitis. The truth is that most chronic tendon conditions are not inflammatory in nature, which is what that itis at the end suggests. Rather, they most often turn out to be what's called tendinosis. And that osis on the end suggests degeneration rather than inflammation, which is worse, unfortunately. Not that there's no such thing as an inflammatory tendon injury or tendinitis at all. There is. And some tendon injuries may start out that way. But when it's been going on for months, chances are the inflammation's largely gone, your tendon hasn't healed, and the process of degeneration is what's causing your pain. Essentially, degeneration means there's a gradual breakdown process happening, and your body isn't keeping up with the repair and regeneration. So rather than a hot, swollen, excessive inflammatory process, imagine something more akin to a cold rot or decay in order to actually picture the degeneration process. And never mind how fiery the symptoms may feel, degeneration seems to produce the same burning pain as inflammation does. Now let's talk about rest. If you've been advised or convinced by what you've read online that you have to completely stop playing the piano or other instrument and rest in order to heal and recover, I have some good news for you. That may not be necessary. Total rest is not necessarily going to help your tendons heal. I call this the resting, hoping, and waiting fallacy. And stopping as much movement as possible is not necessarily going to have any effect on reversing any degeneration that's present. The key has to do with breaking the cycle of stagnation and stimulating healing and regeneration. And this requires a much more active approach. Now let's talk about the key issue, the missing link, so to speak. One of the most insidious underlying causes of these RSIs that malign so many musicians is a little-known issue in the tissue. It's not that well known in medicine anyway. They're called adhesions, which are just what they sound like, areas of tissue that have become stuck together. It's a necessary property of the collagen protein that the majority of your tissues are composed of. Collagen has to be able to bind to itself in order to form complex structures like tendons, ligaments, and cartilage. And when there's either an acute injury to your tissues or a sustained chronic period of friction, irritation, compression of your tissues, you get adhesions. It's also known as scar tissue. You get a lot of scar tissue quickly when you sustain an acute injury like a tear. Your body has to fill in and secure and mend that torn area quickly. And you can very easily feel the difference before and after the injury. The injured area becomes much more restricted because the scarring and repairing process is rather haphazard and excessive. It's often kind of overkill. The process of adhesion formation is very gradual though, usually happening at a snail's pace. It tends to go unnoticed until it accumulates significantly and starts to produce symptoms like stiffness, loss of flexibility, muscle fatigue, and muscle and tendon pain, which no one attributes to adhesions, of course. Now here's where this insidious process impacts pianists the most. Pianists, along with many musicians, have to perform countless finger motions in order to play the piano. The vast majority of the finger and thumb muscles are found in the forearm, and they act on the fingers by way of long tendon cables. And these long tendons of the wrist and fingers have an additional anatomical component that most tendons don't: synovial sheaths. The synovial sheaths serve to cushion and protect these tendons as they pass over either side of the wrist, where they're subject to more potential friction. And these sheaths are filled with the same fluid that's found inside your joints, synovial fluid. Hence the name synovial sheaths. The problem is that due to thousands of cumulative motions and other factors like excessive tension and maybe not optimal piano technique, adhesions begin to form between the tendons and their sheaths, and often deep in the layers of muscles that they're attached to. Stress, poor diet, drug and alcohol use, and lack of exercise and lack of hydration may also play a role, especially in more of these negative factors are in play. A few adhesions here and there in the body is inevitable and not a big deal. But when they're accumulating in your finger tendon synovial sheaths, you may develop what's called Tenosynovitis. At least that's what it's often called if it's the primary issue. The itis suffix suggests an inflammatory process. Now that may actually be occurring in some cases, especially in the early stages. Long term, however, it's probably become a degenerative process. This is what they diagnosed me with nearly 30 years ago, Tenosynovitis. And what seems to have led me down this path of specializing in helping people with this and similar RSIs like golfers and tennis elbow. Looking back, I don't believe I had any significant inflammation in my wrist extensor tendons, but I did have a lot of tension and adhesions in those tendons and their muscles that I was completely ignorant about how to treat at the time. I was just getting started in my field of bodywork and massage therapy, which was how I injured myself, not playing the piano. And I didn't have the techniques I later learned that were so efficient at releasing adhesions. So next, carpal tunnel syndrome can be the consequence if this dysfunctional dynamic happens in the finger flexor tendons as they pass through the carpal tunnel at the palm side of the wrist. This is the most serious manifestation of these kinds of tendon problems because as the friction, swelling, and pressure builds up in the carpal tunnel, it begins to affect the median nerve, which is also in the tunnel, potentially damaging it. Obviously, nerve damage can be very serious. You then develop the telltale symptoms of CTS, numbness, tingling, and or pain in the thumb, index, and ring fingers, and usually dramatically declining grip strength. DeQuervain's Tenosynovitis, affecting the thumb, is another manifestation of synovial sheath, adhesion, irritation, and pain. This is a much less serious issue, though, since there's no risk of a serious nerve entrapment dysfunction on this side of the wrist. And let me just clarify, I'm not saying all these injuries can be explained exclusively by the adhesion buildup process, just that it's a major but largely unrecognized factor, and one that you can address yourself, which we'll get to in a bit. Okay, so what's the conventional approach to treating these injuries? Whether we're talking about tennis elbow or tenosynovitis of the finger extensors on the back side of the wrist, or the flexors on the palm side, which can snowball into CTS, or golfer's elbow. The standard treatment approach, unfortunately, focuses on the acute symptoms rather than the chronic causes, which is the adhesion buildup and the chronically shortened, weakened muscles. I describe this conventional wisdom allopathic strategy as the sick approach. S for suppress the symptoms with pills and shots, I for immobilize with braces and splints, and C for cool with ice and cold packs. And perhaps the K should stand for kills your chance of healing in a timely manner. Now don't get me wrong, this approach will tend to reduce your symptoms, temporarily anyway, but is that really your primary goal? We have to keep in mind that which manages and suppresses our symptoms and that which supports our healing process are two completely different things. In short, inflammation is a stage of your healing process and not the real problem. Immobilizing these injuries doesn't help them heal, and icing the heck out of your poor tendons doesn't help them either. And the last thing you want is to have your precious tendons injected with cortisone. Cortisone can do a lot of long-term damage, so I hope you haven't gone down that road yet. Is there a better approach to treating these injuries? Yes, I'm convinced there is, and I'm going to suggest it involves using heat to increase circulation, at least avoiding ice, allowing the symptoms, especially inflammation, if it's even there, again, it's part of your healing process, with the caveat that swelling can be dangerous when we're talking about carpal tunnel syndrome. And mobilizing the area, especially with massage therapy or self-massage techniques and stretching, and the right exercises when the time is right. But the number one priority is to release those adhesions. And with the right approach, your tendons can be freed to slide more easily in their sheaths, and your chronic tension and adhesion-restricted muscles can be released and restored. The number two priority is to stimulate the tendons. What this comes down to is strategically bothering the tendons, so to speak, with the right amount of friction to break the cycle of stagnation. Tendons, once again, have this nasty habit of not healing well and slipping into a state of stagnation and degeneration. Newer medical interventions acknowledge and attempt to address this through techniques like platelet-rich plasma therapy. I don't believe this is necessary in most cases or such a great idea to go to such invasive extreme measures to accomplish this, however. I've been getting great results for years working on tendons by hand and teaching people self-massage techniques to use at home. The bottom line is that more circulation and more metabolic activity needs to be stimulated in and around the tendon, rather than suppressing circulation and inflammation and allowing the decay of stagnation and degeneration to continue to weaken it. Will any massage technique help? Many kinds of hands-on manipulation may be beneficial. However, honestly, freeing up dense, sticky adhesions is not the easiest thing to accomplish. Merely pressing with hands or tools, rubbing or kneading tissues, or rolling with foam rollers and such can be very inefficient at this process. There are countless videos out there showing you all manner of techniques, which may be good for reducing tension and good for overall muscle health, but may not help you get the adhesion-releasing job done. That requires the trifecta, if you will, of pressure, friction, and tension in the right combination. Now, if you're wondering, should you seek out a professional massage therapist, body worker, neuromuscular therapist for help with this? Absolutely, if you can. Finding the right practitioner is not always easy, and it is usually expensive. And although most musicians probably can't afford to see a therapist several times a week, the good news is you can learn how to use these powerful adhesion-releasing, tendon-stimulating techniques and work on yourself every day at home. This is the core of what I teach here at Tennis Elbow Classroom. And if you're not already here, I invite you to come on over and read the full piano-related injury article, since it has some details I didn't cover. I also have dozens of treatment-specific articles on heat versus ice, splints and braces, lotions and creams, acupuncture, dry needling, physical therapy, and most importantly, why cortisone shots are the worst mistake you can make. And there are a lot of treatment mistakes to avoid when it comes to these kinds of injuries. And if you're at the point where you need a comprehensive guide to show you exactly how to treat these vexing injuries yourself with the kinds of advanced techniques I'm talking about, I have that for you, including both tennis elbow and golfer's elbow self-help programs, which include lessons on releasing the synovial sheath areas of both your wrist and finger flexor and extensor tendons, as well as those muscle groups, which is critical whether you have tennis or golfer's elbow or a wrist or finger tendon injury. Now, I don't have a program specifically for piano players, not yet anyway. I'm definitely considering it, but I've had musicians, including some pianists, use my program successfully. If you're watching the Vimeo version of this video and you'd like to learn more, you'll see links to both programs at the end of this video. If you're watching the YouTube version, look for the links in the description below the video. And if you're listening on a podcast app with no links, just start by going to tenniselbowclassroom.com. One last thing, whether you're on YouTube, iTunes, Stitcher, or some other platform, please subscribe and leave me a rating if you can. Thank you so much. This is Alan Willett from Tennis Elbow Classroom, wishing you a speedy recovery and a long career, or hobby, playing the piano. Let's break your vicious cycle.